Hello, everyone, and welcome to Centers and Margins, a podcast about global health, systems change, and what it means to lead and to learn from spaces where people, power, and priorities collide. My name is Nkechi Olalere, a health financing and systems advisor with over 2 decades of experience traversing the private sector and the public and development sector at the intersection of policy, politics, and reforms all across Africa. This podcast is about reflections, about moments when I have had a front row seat at the center of the action, and other times when I have been on the sidelines, observing, silently influencing, or sometimes wondering if I belonged. This is also about the larger centers and margins, about spaces where global health priorities are set and who gets to determine the agenda. It's also about how some ideas from the periphery disrupt the core, or sometimes are silenced before they can. In this podcast, I share my thoughts, my realities, with the whole idea that hopefully it sparks something that is helpful for your own work. And in the same way, you are also able to share with me some tidbits, some ideas that can also help and support my own work. Episode 1 of Centers and Margins introduces the origin story of debt swaps in Sierra Leone. It traces the journey from an inspirational ministerial vision to a creative financial tool that really sought to introduce additional resources, unlock additional resources for the health sector without introducing additional debt. It also explores how countries might reimagine liabilities as tools for progress, and how listening and humility can shape early stage financial, early stage policy ideas. So the first question people typically ask me is, why debt swap? How and why did that idea came up? And this is it. I arrived in Sierra Leone in the summer of 2022 as the special advisor on health economics to the Honorable Minister of Health. And of course, my very first meeting was with the Honorable Minister to get a sense of his vision and what he felt were low-hanging fruits that can actually be pulled at this time to make sure that there was trajectory towards his key plans. And at that meeting, the minister was very clear. He shared his very ambitious vision for rethinking health service delivery in Sierra Leone through the life stages approach that sort of sees, recognizes, and identifies individuals in their respective journey through the health system at every stage of their lives, from birth till death. And now, of course, we also then had to turn to how this very ambitious plan was going to be funded. And the minister was very clear in speaking to the fact that partners have been very helpful in complementing the government of Sierra Leone's contribution and funding of the health sector. But of course, he also had concerns about sustainability of donor funding. And so it was, how do we make sure that what funding we have now from the government and from partners, we utilize them well, but then where do we move to then also fill up the financing deficit? And so after the meeting, I had a lot of work to do, just reflecting on what I had learned from the minister. Personally, I have always been a big fan of doing the fundamentals well, because if you do the fundamentals well, then there is very little that another shiny, bright tool can actually do for you, very little. And so I figured that if we mobilized significant or adequate financial revenues domestically, if we were able to pull this together with donor funding, reducing fragmentation, and then we're able to utilize data and evidence to allocate these resources to the places where we would get the biggest bang for the buck, we were almost at the finish line. However, there was nothing that then said that we could not keep doing this while also looking for additional opportunities to bring in funding into the health sector. And so that's where my mindset was after reflecting on everything I discussed with the minister. And then I started doing a lot of desk research just to find out what is out there, what are other countries using, what are other countries or partners supporting countries with, things that expand the fiscal space. And so it was this desk research, literature review that brought me up to the work that the Debt Coalition was doing in Sierra Leone, advocating for debt relief. And this was, of course, in the wake of COVID-19 and all the economic headwinds that lots of countries were facing. And so I came across this document online, and it spoke to the debt situation of Sierra Leone. It spoke to a debt of about $3 billion as at 2020, and that this debt of $3 billion was already more than the budgets for 2019, 2020, and 2021. And so the Debt Coalition was advocating for debt relief for Sierra Leone. And I found that this was a very useful conversation and useful tool. But I got to thinking, because we all know that there are so many different sectors with competing priorities, equally important priorities. And so if a debt relief was provided for Sierra Leone, there was no certainty that that funding would necessarily end up in the health sector, or that the health sector will get any of it. And so I turned my mind to thinking to, if there was political will for this, how can we ensure that some of these monies would come to the health sector? And again, in doing a lot more work, a lot more literature review, I then hit up against the idea of debt swaps. Now, why debt swaps, and what do these debt swaps mean? With a debt swap, a creditor country agrees to allow the owing country to utilize all or part of what it owes it to achieve some specific projects, priority projects that are identified and agreed on. Now, what made this something that we could literally utilize in the health sector was that there was a particular instrument called the debt to health swap. That meant that these monies that are forgiving, these monies, the equivalent amount, has to then be utilized in the health sector. And so the debt to health swap is health sector specific, meaning that whatever funds are unlocked from the swap would come directly into the health sector. And so I was excited by this, because we know that at that time, lots of countries were struggling with the economic headwinds that had been brought on by COVID. And so anything that supports us to unlock the fiscal space, in other words, create real room within the budget to fund the health sector without sacrificing fiscal discipline or taking on new debt, was something that I was very excited about. And so the debt swap for me then became an opportunity that we could explore as a country, provided I was able to get the necessary clearances to figure out how we could move forward. And of course, in doing all of this literature review, I wasn't just focused on the positives. I knew that it was important to understand the totality of this instrument, where it has worked, where it hasn't worked, what the challenges were, because these were the things that would really tell us whether Sierra Leone could actually leverage this. And so I started digging, and the story wasn't always pretty. The debt swap has had a very complicated existence so far. And there are lots of cynics and lots of people who speak to the fact that it's probably not a great tool for every country, because of the following reasons. Number one, they speak to the fact that the transaction costs oftentimes are even more than the monies that would be unlocked potentially. They speak to the fact that it is not easily adaptable in every country, and give the examples of some countries that are fragile and those countries that have low capacity. This may not be the best tool for them. It spoke to low parliamentary oversight and therefore very little ownership and very little transparency with this. And it then also spoke to the fact that this typically does not have significant scale. And so these are not small issues that were flagged. These were major critical issues. And I reflected on all of this. But then I also saw some good stories coming out from some other countries like Antigua and Barbuda, where they had utilized this debt swap for climate. And some of the things that they pointed to that led to their progress was the fact that they had very strong negotiating teams. They had a strong line of sight between the monies that were going to be released and how it was aligned with the National Development Plan. And they also had very strong implementing partners. And so with all of that, it then sort of struck me that the challenges that had been flagged about adaptability, about the scale, about governance were not necessarily fatal flaws. These were more like design flaws. And so if you anticipate them, potentially you can mitigate them. And for the issue of transaction costs, yes, high in some instances, but there were specific issues that led to these ones being high. And so if we're mindful of this and not pretending that these issues don't exist, then potentially for Sierra Leone, if we all agreed on this moving forward, we will then be able to draw up a risk map that captures all of these cautionary tales and tries to come up with mitigations. And of course, if we can't, then maybe we decide then with evidence that maybe this does not make sense for us. But at that time, I did see that these were not fatal flaws, but more like design flaws that we could address as we moved forward. And so with all of this said, I then realized that there were also additional benefits to Sierra Leone. Number one, for the health sector, the minister would be able to get the funding that he needed to be able to fund the plans that he needed. For the Ministry of Finance, they would be able to create real room within the budget to support the health sector. And this would not get them to forgo fiscal discipline or even take on additional debt. And they would also be able to then potentially meet the Abuja targets, the Abuja declaration target of allocating 15% of their budget to the health sector. And of course, Sierra Leone would stand out as a country that was very interested in looking at innovative financial instruments to create space for health and, of course, show other countries other ways that monies can be generated within the economy. And so, with all of these positives, apart from the fact that, yes, a debt swap is unlikely to take care of a debt situation of about $400 million. But even the $10 or $15 million that could potentially be released from a debt swap can support health system strengthening, can show the government, signal government's commitment to utilizing innovative financial tools, and also be able to crowd in additional funding. And so, as a tool for progress, this made sense. The icing on the cake was also the fact that debt swaps absolutely aligned with the government's idea, with the government's goal of improving human capital development as a step towards longer-term economic prosperity. And so with this desk research done, and with all of these issues mold, the positives and the negatives, I then knew that I was then ready to move on to the next part of this conversation. And so as I end this first episode, I'll take a moment to just reflect on some of the lessons that for me are coming out from this conversation, even this early stage work. The first one was that for anybody who works in this high level political spaces, it's very important to be humble and to listen. Don't assume that you know what the problems are. Don't assume that you can read between the lines and figure out what the issues are. Ask what the issues are. In my meeting with the minister, I asked him point blank, what keeps you awake at night? And he was able to share with me what his concerns were, what his issues were, and then we started working with that to then figure out what the potential solutions could be. The second thing is then ensure that you're not just thinking about the next bright, shiny tool. The question is, what are the fundamentals that we need to do properly? What are the fundamentals that ensure that we will have progress? And then if there's even any additional solution being brought in, the question is, how does it strengthen the fundamentals while not creating just a parallel instrument? And so for me, thinking about the fundamentals of health financing, domestic revenue mobilization, pooling to reduce partner and donor funding fragmentation, and then strategic purchasing, utilizing data and evidence to allocate. Strengthening this then meant that while we continue to pull those levers, we can then introduce additional ways of actually increasing the revenue that was coming in. So it's strengthen what you have, make sure that you continue to work on that while you then introduce other things. So you can work on these two things at the same time, but don't forsake the fundamentals for any bright new shiny tools. In fact, specifically on the efficiency, I am always a big fan of this because I keep saying that if you have leakages within the system, no matter how much more income that you bring in, you will never know if you have enough. So the income bit is important, but it's very important to ensure that we're fixing the leakages within the system while you're also working on new tools. So it's balancing those two. The next point that is a learning lesson for me is the fact that you need to think holistically about the challenge. You need to ask yourself to do the desk research to understand everything that there is about whatever solution that you're proposing. Don't just focus on the good, don't just focus on the bad. Look at everything, the good, the bad, the ugly, so that you present a balanced recommendation as to what you see and what you feel makes sense from this situation moving forward. And so the other learning point for me was be very clear about the benefits. At the end of the day, for anyone to decide that they're going to spend their social or political capital to champion a brand new solution, you need to be very clear what the benefits are. And as you start talking to different stakeholders, you need to be able to break down the benefits that you see for the country, but then also how it helps every stakeholder in the conversation shine. How does this make your life easier? How does this make your work easier? But ultimately, how does it benefit the country as a whole? And then it's also important to see how this solution, recommendation, aligns with the national plan, whether it's national strategic plan, whether it's the economic development plan, whatever it is that has already been delineated or captured as a national plan. How does any idea align with that and not creating a brand new thinking? Even though, of course, innovative ideas, but you need to link that up with the overarching national development plans or national plans that already exist. And then the final thing for me was just coming into spaces and not already having prescribed solutions to issues, to be willing to sit in ambiguity, to take feedback, to take comments from the political leaders that you're working with, the technical leaders that you're working with, and take that, sit in that ambiguity and begin to ask yourself what options are available. And so these are some of the lessons that I feel come out from this particular episode. And I would love to hear from you what you think about this. What's some of the lessons that you think are coming out from this? Does this have any line of sight to some work that you're working on or that you're leading, some issues that you are encountering, and how you started that process? I would really love to hear from all of you. And the second episode, I will then tell you what I did with all of this information that I had come up with and how we continued the journey on the debt swap until we get to the final episode of where we are with the debt swaps. And so until then, keep thinking, keep reimagining, and keep making sense of this global health space. And please drop me your notes whenever you can, so I also understand what you're working on. Until I see you on the next episode, have a good one.